AETCM, the emergency medicine channel. Today we'll be discussing a young male who presented to our ER with electrocution. A 25-year-old male patient was brought to ER with an alleged history of electric shock to the left forearm. On initial 10-second assessment, patient was conscious, oriented and obeying commands. Primary survey, his airway was patent. He was talking in one full sentence. There was no pooling of secretion, gurgling, stridor, no clots in the mouth or any features of maxillofacial injuries. C-spine was normal and patient was sitting up in the ED. So, and he was able to move his C-collar and his sensorium was also normal. So, C-spine was presumed to be normal. Sir. Breathing, respiratory rate was 18 per minute with a saturation of 98% in room air. Chest movements were bilaterally equal and air entry was also bilaterally equal, and there was no subcutaneous emphysema or features of flail chest. Circulation, heart rate was 86 per minute, blood pressure was 120/80 with a map of 94, CRT was less than 3 seconds. There was no active bleeding from anywhere or at the site of injury, and all peripheral pulses were felt equally and bilaterally.
You noticed some external injury?
Yes. There was an injury to the left forearm, but there was no active bleeding from that. Disability, his GCS was E4, E5, M6, pupils are 2 mm reactive and his pain score was only 2/10. He was given some analgesics from outside. Sir. And he was able to move all 4 limbs, even the injured limbs he was able to move. His GRBS was 146 and exposure, his temperature was 98 degree Fahrenheit and hypothermia was prevented by blanket. And in we exposed the part which was affected. There was 2 lacerated wounds over the extensor aspect of the forearm. He was exposed to an electric rod. After that, he got the electric shock and there was a burns to that area. But since it was I think it was involving the deeper structure, so he was not complaining of much pain over that area.
This was happening in the house or household electricity or industrial?
Industrial, sir.
Industrial.
And that was. Adjuncts to primary survey at present.
Was there any other burn marks, any other sites?
No,
what's
sir.
The relevance?
Thing is, there can be an entry wound and exit wound, sir. So if at all the electricity is entering inside the body, usually it will exit to the ground. So there will be an exit wound either in the foot or if the patient is sitting
contact
with the earth, that there will be an exit wound. So that was also exposed and that was not there, sir, in this patient.
So it was more like an isolated upper limb?
Isolated upper limb maybe. Usually exit
the patient was otherwise hemodynamically stable, no other issues?
Usually exit wound might be an yellowish or a greyish spot like a wound will be seen mostly in the lower limb. That was.
He is standing on a wooden stool. Sometimes the exit wound may not be present. So direct contact with the earth, there will be many.
So adjuncts, at present his airway and breathing is normal. So 2 large bore IV cannulas were inserted and patient was connected to cardiac monitors and a 12-lead ECG was taken, sir. ECG showed a normal standardization, normal axis, PQRS, ST segment, T was were normal and normal R-wave progression. And
what's the relevance of ECG in electrocution?
Electrocution, depending on the type of electricity, sir. So if it is an AC current, there can be AC current will be on alternating current. So because of that, patient can go into a VF, or if it is a direct current, a high voltage DC current, patient can go in for a ventricular asystole can be there. And otherwise, because of some amount of lower voltage electricity can cause either it can cause coronary vasospasm that can induce an MI, or sometimes it can cause blocks also.
What is found mostly in domestic places, houses and household? What is the current?
Household, there will be a low voltage AC current will be there. Industrial areas, there will be a high voltage AC current will be there. And lightning, and if it in some generators and all, and in the railway tracks and all, there can be DC current.
Even vehicles, I think it's DC.
Batteries and.
We offered analgesic. At present, patient doesn't have any pain, so he refused analgesics. Sample history, there is no allergies, there is no, patient is not taking any medications, no other past history. Last meal was 8 hours back. So events was patient has an electric accidental contact with an electric rod in his forearm while he was working in his company. It happened 7 hours back. So the event was while he was walking, he accidentally came in contact, his left forearm lateral aspect came in contact with the rod, and immediately he was able to pull it away. Away from that, and leaving a 72 centimeter laceration over the 72 into centimeter and 5 into 0.1 centimeter lacerated wound over the left forearm, but there was no trauma to the patient, or he was not thrown away. After that, he was in full sensorium. There was no loss of consciousness, seizures, or anything, and he didn't feel any palpitations or chest discomforts. He was taken to a primary care center, and he was given tetanus toxoid injection, and wound debridement was also given, and he was having a lacerated wound, deep lacerated wound. They just did the primary closure, and they have referred here for further management and further care. And there, that hospital, he was observed for 6 hours, and after monitoring the cardiac monitors and all, he was then referred here for the closure of the wounds. So secondary survey, head to foot examination. Ideally in this patient there was no findings, but in case of a electrocution patient, we have to from the head to foot, when we are examining, in the head there can be depending on the entry wounds, there can be injuries to the skull and all, and sometimes patient can be having weakness depending on the electricity which has entered. So there can be lower limb weakness can be there, or patients can be presenting with an altered sensorium or seizure or anything can be there. Then in the eyes, when we are coming to the eyes as such, there can be, we have to look for any features of any keratitis or any injuries to the eyes. In the later stage, they might go into a cataract and all, and some there can be changes in the macula and retina also. And depending on if it is an explosion and all, there can be injury to the tympanic membrane and all, it can be there. Then in the lip examination, especially in children who comes in contact with electrocution, what will happen is they will be biting onto a wire and all, so there can be lip injuries in that. Then movements of the limbs should be examined because it can affect the spinal cord and spinal
children, when they are biting a current, see, apart from the oral injuries, there may be bleeding also. The facial vessels, they may be eroded by the electric current. So there may be hemorrhage and aspiration chances. This also you have to keep in mind. Okay.
Then in the extremities there can be whenever the patient comes in contact with the electricity, what is happening is as the duration and as the amperes of electricity increases, there can be a tetany, and that tetany can itself cause muscle weakness, or even it can cause fractures also. Actually bone is a poor conductor of electricity, but a vascularized bone, that means a fully perfused bone can conduct electricity, and nerves and vessels are good conductors of electricity, so there can be damages to that also. Then coming to the cardiovascular system examination, I have already told there can be arrhythmias in that, and depending on the type of explosion and everything, there can be pneumothorax and other injuries can also be there, and even in the abdomen there can be paralytic ileus, and perforation also can be there, sir. And in the peripheral nervous system also, depending on the exposure to the electricity, there can be nerve damages, and which can be permanent. Even it may not be picked up in an NCV or anything, there can be permanent nerve damages. These things should be checked in, sir. And this was checked for this patient, and everything was absent. There was only isolated injury, sir.
Okay.
What are the life-threatening conditions may exist in electrocution? One is you told regarding the CNS, seizure and coma.
Coma.
Then any other thing
Arrhythmias.
regarding the respiratory?
Arrhythmias can be there, sir. Then
Cardiovascular.
direct, if at all the electricity is directly coming to the respiratory center, the sudden respiratory depression can be there, sir. Sometimes when the patient get exposed to an electricity, there can be sudden asystole which is happening, and sometimes the patients after that the patient can regain the pacemaker will again produce an impulse, and this patient can the heart will start this electrical activity by itself. But that time, if the respiratory center is getting affected, the patient will go into an apnea. So the heart might be beating and the patient will be in respiratory depression. That also can be.
For that question, you have to broadly classify it into acute and late onset. So, what are the late onset life-threatening complications?
Late onset complications are depending on the nerves involved, sir. If we are talking about the nerves as such, there can be a delayed injuries to the spinal cord and all because of the vasospasm and all, or there can be delayed cell neuronal damages that can cause progressive damage and weakness, and otherwise also psychologically and neurologically also patients can have
If there is severe muscle involvement, there
rhabdomyolysis.
can be
Rhabdomyolysis,
rhabdomyolysis leading to
renal involvement,
You
rhabdomyolysis.
should not miss rhabdomyolysis. Okay. Yeah.
Then in the same at the site of wound itself, there can be this thing compartment syndrome and these things can
contractures.
conduct.
So, you want to tell something more about rhabdomyolysis? How will you diagnose and how will you treat?
Rhabdomyolysis usually comes because of the massive muscle activity and everything. So
Destruction.
muscle destruction will be there. So we have to evaluate for that. So we will have to send for the counts, and the renal function should be monitors. And in that specific test is the CPK. CPK will be elevated more than 5 times. It will be elevated. So the treatment for that
Anything
is
in the urine?
Urine
urine
myoglobin
myoglobin will be
positive.
Treatment for that is hydration, adequate hydration to open up the kidneys. So we should hydrate the patient so that we will be getting a urine output. Usually we will be expecting a urine output of 0.5 to 1 ml per kg, but here we have to target a higher urine output, 1 to 2 ml per kg. Even though we are seeing some burns in an area, if we calculate according to the Parkland formula, we will be underestimating the fluid requirement.
Why?
Because the depth of the injury will be more. Superficially there might not be much findings, but the electric shock might be entering inside, and it will be causing muscle injury and everything.
4 ml while calculating also it will be like 4 into percentage of burns into weight rather than the normal.
Yeah. So, basically, the external injuries may not match the real damage, internal damage which has happened, right? Okay.
So this target urine output should be maintained, and adequate hydration should be given, sir. And analgesia should be given, and
Associated electrolyte imbalance like hyperkalemia can happen in rhabdomyolysis. That should be like also addressed. Then chance of like infections will be there associated with the wound.
Okay.
That should be like managed.
Fine.
Acidosis because of muscular damage, potassium level as well as acidosis should also be corrected. And the type of wound commonly present is called bullseye. There are 3 zones will be there. The central zone is completely electrolytes are very deep and dark black in color. Forward to the middle and outer zone. Outer zone still the coagulation type of necrosis may be continuing, and it will be reddish in color. So in between a dry zone, that will also be. There is a typical both in the entry as well as exit wound. How will you differentiate between entry wound and exit wound?
Depending on the electricity, there can be some clues. Whenever the electric current enters the body, there can be an injury because of the electric current. Then there can be injury because of the thermal injury. That means burns and all can be there. And in some cases, there can be a trauma. A patient might be thrown away, and trauma also can be there. So 3 injuries can be there. So usually electric injury with thermal injuries might be present in the entry wound, and exit wound it will be seen as a gray or pale area.
When compared to exit wound, entry wound will be very small. Exit wound will be very deep and extensive. This will be smaller in nature. almost same type 3 zones will be there. And as we told, when the person is standing in a stool or in a height, suddenly is having the C-spine involvement also should be suspected. And asphyxia, see the tetanic nature of contraction in the respiratory muscles, intercostal diaphragm. Persistently, this will lead on to apnea for a while and then hypoxia. So this is most important. This hypoxia may cause cardiac arrest also. And directly the stimulation leading on to the precipitation of ventricular fibrillation or asystole. This may and also myocardial damage, necrosis may also occur apart from this.
What are the key things to remember in resuscitating a patient with cardiac arrest following electrocution?
Thing is, sir, cardiac arrest secondary to electrocution. The patients either might be. The thing is, there can be either ventricular fibrillation or asystole. Actually, the outcome is much more better, sir. So even though whenever we are approaching a mass scene where there is a many patients are affected, usually we will be first resuscitating the red patients, and the patients in cardiac arrest or the patients coming into the black category might be kept apart. But in case of an electrocution, the patients in cardiac arrest we have to revive first, sir, because there is high chance of recovery. The patient might be in a asystole and heart might pick up after resuscitation, sir. And always we should be careful while we are going into if we are being a part of the rescue team, we have to be very careful. Make sure that the electric current which is the main that is switched off, and we should enter the area. And even the whenever we are touching these things also, our usual surgical gloves and these things will conduct electricity, so that all should be
So scene safety basically.
Scene safety is important, and we should be walking at least 10 meters away from the source of electricity.
Okay. And duration of resuscitation?
Duration of prolonged resuscitation is required, as we do for hypothermic cardiac arrest. Prolonged resuscitation
It's justified in such scenarios. Regarding pain management?
Pain management, sir, we can give initially we can give paracetamol, then we can give small opioids can be given. Usually NSAIDs are avoided because of the rhabdomyolysis and renal failure which can occur. NSAIDs should be avoided, sir.
What type of pain relief did you use for this patient?
This patient already he has received analgesics from outside, and he was not having pain over that area. Maybe because of the analgesia, and he was primary suturing and everything was done, so it was not having pain. But while we are debriding, we have to give analgesia. Either local lignocaine should be given, or
any role for nerve blocks?
Since it is in the forearm, we can give nerve blocks.
Axillary
blocks can be given.
Block, yeah. Intravenous analgesia.
It can be.
Analgesia we can give under tonic.
Anything else? What happened to this patient?
This patient was monitored. There was no abnormal rhythms or any premature contractions and all. So so after monitoring in the ER, this patient was transferred under plastic surgery for the definitive management of the wounds. And there was a lacerated wound, and there was some partial injury to the extensor carpa radialis longus muscle, belly, and suturing of that was done, and it was
complete closure was possible. There was no need of any graft or anything.
No, sir. And the monitoring of the electrolytes and CPK and renal functions were also within normal limits.
What is the ARC type of electrical injury? ARC type.
ARC, ARC.
ARC type of electrical injuries, usually what is happening is, if the patient, the electricity will be flowing, and if the patient comes in contact with that, depending on that.
Yeah, when you are very near the high tension lines, it will not happen in the household line.
May not be a direct contact. May not be there.
Something like lightning.
The conduction will happen through the air itself. So the close vicinity need not touch the electric pole or electric appliances. Even in this current may be conducted in certain circumstances. It will be there.
Within the 10-meter difference if the patient.
Yeah. And the flame type?
So it will be like burning objects.
Burning of the cloth
thermal
or
things
surroundings. That will also. What is the heat produced because of electrical engine current? The amount of heat produced. It goes from 20,000 Fahrenheit, sorry, 2,000 to 5,400 Fahrenheit. Okay, that's much heat will be produced. Mostly the thermal type of injury, and the regarding the cardiac, this one direct. Even minimal voltage can precipitate ventricular fibrillation. 0.1 amp, that is enough.
When do you call it as high energy impact? How many
more
watts?
than 1,000 volt is called as high voltage.
So more than the external visible injuries, you should not ignore to diagnose internal damages also. This may happen in places.
Anything more to add?
Usually, sir, in case of low voltage burns and like 0.5 to 2 and all, the patient might be having some pain or anything. After, if it is going more than 2 volts and all, the patient might be having some tetany like spasm, and if it is going beyond that, this patient might be having like more than 30 volts and all, there can be respiratory depression, and these things can happen, sir. And if it is going beyond that, there can be ventricular arrhythmias and these things. So in household and all, we will be using 120 volt will be used, AC current will be used. So even household electricity can affect the individuals.
Okay.